I like to tell patients that it is similar to acne of the eyelids. Again, it's a dysfunction of the oil glands.
What happens is an infection gets caught inside that gland, and then it just starts getting bigger and bigger. And it can get very red, very painful, and large within a day or two. It can even get large enough to close the eyelid.
It can be in the upper lid, it can be in the lower lid. They can occur at any age. We don't know exactly why it happens.
Of course, as doctors, we can't use the word Styes, so we call it either a chalazion or a hordeolum. Okay, those are the two medical words. But Stye covers all of the bases.
Everyone calls. Everyone wants to be seen that day because it's an emergency. And so we have to really talk a lot of people off the ledge and let them know that it's something simple, it will go away very quickly, and it's not an emergency.
Some patients who have chalazions, they'll describe it to us on the phone. We advise them to go ahead and start warm compresses.
As far as compresses, a nice little trick is to hard boil an egg and put it in a wet washcloth, and that way you can keep the heat going for about 10-15 minutes. That'll make it go away quicker.
And we will ask them to come in within, a 24 to 48 hour period to examine them and be sure that there's not something more serious going on. We're going to have you put warm compresses on your eyes, and what the warm compresses do is they melt the oils in the glands, allow them to become more liquid so that they can get out of the gland properly. Most are styes. Sometimes they can be tumors of the eyelid, so we definitely don't want to miss that, and we also worry about infections.
If you're running a fever, if you have any pain on eye movement, those are all reasons to see a doctor instead of just waiting.
If the stye does not improve at all, or improves some, but then persists after continuous treatment, then we would drain the stye.
And 9 out of 10 times, it will start draining internally by itself and go away. 1 out of 10 times, we actually have to give nature some assistance. A little bit of surgery in the office, nothing bad.
There are some other conditions that look like styes that are actually cancers of the eyelid. So in a chronic stye that hasn't resolved with even an attempt to remove the stye surgically, you have to be sure that there's not an underlying cancer of the eyelid.
Most people get 1 or 2 styes per lifetime. If you're getting one stye after another, it could be a sign of a skin condition.
So it can really look bad and convince you there's something very bad wrong with your eyes. And the pain can get very significant also. It's not ever dangerous to your vision. It's just dangerous cosmetically because you look bad.